Hey everyone, TomandBunny here, and I know we're getting ready to watch our next video, and if you find this video useful or some of the videos in the past, please do us a favor by booking your travel through us at tomstrips.com or give us a call at 1-800-285-0853 and I can answer any questions and get you booked on your next lifestyle vacation.
Smile. Oh, you gotta look at the lens.
So cute.
Hey everyone, we're TomandBunny, and we promised you an update 3 with my urologist, Dr. Joshua Calvert from Nashville, and you are with Urology Associates.
That's correct. Yeah.
And I'm going to have Dr. Calvert introduce himself to you and give you a little background about himself.
Sure. Yeah, and you guys, in this world, you can definitely call me Josh. That's just fine.
Okay.
That's totally fine.
We always go with respect.
I love it. I'm Josh Calvert. So great to be here. Thank you guys. It's an awesome opportunity to talk about something that I love to talk about, which is men's sexual health and erections. I love it. It's just what I like to do. I know that's weird. It's what I like to do. I'm originally from the West Coast, so far away. I went to school at the University of Washington for medical school, and then made my way to Nashville in 2016 for urology residency at Vanderbilt, which is a long, tough process. I then did an additional year of training in kind of men's sexual health, specifically in microsurgery and implants. So I do a lot of implants, and my practice is 99.9% men now, and I talk to them about anything that they want to and talk about erections all day long. So I have the best job in the world, in my opinion.
That's awesome. Now, Josh told us when we met him that his life's goal is to help every male achieve an erection.
Yeah, absolutely. I mean, so it sounds really silly. I tell anyone that will listen to me that if there's a guy out there that wants to get a good, dependable erection, we can get them one. And that's a promise. So it's a matter of how aggressive you want to be, but any guy that I see that wants to get a good erection, we can get them one.
Okay.
That's awesome.
And we're going to put Josh's card right on the screen right now. And a lot of people are going to ask, can anyone contact you, and can you do it through Zoom or telehealth?
Yeah, absolutely. So I do a lot of telehealth. At some point in the process, I obviously want to get in person with someone to discuss potentially an implant or whatever it is that we're talking about. But yeah, I do have the ability to do telehealth at a lot of different states. I have licenses in multiple states, particularly in the Southeast, but actually across the United States. So if you're in a region that I cover, I'd be happy to see anybody talk about whatever you want over Zoom.
Now, they can also fly into Nashville and see you, right?
Absolutely. I mean, that's the dream. That's the easiest for me, but
right,
I'm happy to help you
So
guys.
You're not practicing medicine in their state. They come to you. Is that correct? Or
yeah.
am I wrong?
No, I do have medical licenses in a lot of states, so I can practice medicine via telehealth in a lot of states in the U.S. But ultimately, I practice out of Nashville, out of the state of Tennessee, where I would have to, if there was ever going to be a surgery from someone coming in, it would have to be done in Tennessee.
And you would definitely want to see each other.
Absolutely. Would definitely want to see. Yeah.
Well, and also, too, your practice is very convenient to the airport.
It is, yeah. It's honestly probably 15 minutes from the airport, which is really nice. And Nashville is, I'm sure you guys talk about this. Nashville is growing like crazy. It's a good visit, if nothing else, to talk about your erections and go to Broadway. So that's great.
Yeah, I was going to say, you plan your visit on Thursday, Friday. You got the weekend on Broadway to celebrate future
there you go.
erection.
There you go. Yeah, I love it.
Now, we did our original video, and when we were talking to Josh about it, and I said he knew what we did for a living. He kind of knew all about us because we don't hide anything from anyone, especially your doctor. And then I said, do you know we do YouTube videos? And he's like, no. And I had him look up our channel. I said, I don't want you to watch it now, but go down and look where it says Tom broke his you-know-what in Jamaica. And he goes, holy cow, that video's been up for 2 weeks and it has 11,000 views. And I was like, yeah. So not only did Josh watch it, I think the office watched it. I think all the surgical centers in the hospital watched it, because when I went in for my implant, I think every surgical team from every other room came to see the guy who did the video.
Well, you know, and the funny
I should have signed autographs.
The funny part was when we went back to Jamaica the next time, they're like, "You're Tom. You're the guy that."
Broke his.
That's pretty awesome.
So I'm known as the guy who broke his junk. So so we did the original video, and so we invite you to go back, and if you haven't seen it, go watch it. And if you're on podcast, we have a couple show and tells. You can listen to this, but if you want to see the examples, jump over to our YouTube. It's just youtube.com/TomandBunny, just like our podcast. And we did the update number 1, and then we promised that we would be bringing Josh in, and we just finally got a good time to connect, and we're going to discuss what happened and why I needed the procedure, and kind of the struggles that on his end that we didn't even know about, as far as getting me approved and everything. And so the biggest question I get asked is, what happened? Because an implant should last 10 to 15 years of normal usage, and mine lasted just over 3 years. And I'm not upset that it only lasted 3 years. The cars break down when they're brand new. So I totally don't blame anything about Boston Scientific or the AMS 700. I felt that I overused it.
Well, overusing an implant is probably a good problem to have. But the data that we're basing the duration of time that they last on average, we say 10 to 15 years. That's based on data of a typical monogamous heterosexual couple having penetrative intercourse 1 time per week.
Okay.
So that's where the number comes from, is the data saying 1 time a week for 10 to 15 years. So if you're going to use it quite a bit more than that, it's like any other mechanical device. It's subject to wear and tear and can break down.
Yeah, because in my original video, I talked about when people would hear I had an implant, they would come up and ask me questions. Well, not only would they ask me questions, they would like to see a demonstration, and I actually would demonstrate it. And I was just telling Josh earlier that sometimes I was showing it 20 times a day. I wasn't actually using it. I was just pumping it up and then deflating it. And so I figured I got about 10 to 15 years use out of it in a
few years.
So I used to call you a party trick. Now I'm going to call you a demo dummy.
Demo dummy, because I was dumb for demoing it.
Now what do I tell you? Don't you dare!
So now, when we came in, the first thing you did was you had me go to a scan to scan everything.
Yeah, I was very surprised when I first met you that it wasn't functioning. And the thing that was interesting about your story that ended up sort of going down a rabbit hole that wasn't necessary was you had lost a considerable amount of weight.
Yeah.
And so we were concerned that the reservoir component, maybe now's a good time to kind of talk about the device a little bit and what it actually looks like. We were concerned in you that the reservoir component was perhaps folded over on itself, which I had heard happening before.
You actually called Boston Scientific.
Yeah, we talked to them that day.
They said that there was like 4 people that
and that was not the case. Because we had you, as you talked about, you inflated yourself for the scan. Mm-hmm. And what we were doing there was trying to assess, was there a lot of extra volume within the system? And basically that diagnosed the problem of saying, there has to be a leak somewhere in the system, which is how it happens.
Okay.
So this is actually an implant. This is a model. So this is, a much cheaper version than the ultra high-tech sterile version.
What's in my body.
Correct. But this gives a good example of the components that are involved in an implant. So there's really 3 parts of an implant. So there's a reservoir that is implanted next to the bladder that houses saline, sterile saline that's put in at the time of the surgery. It's all a closed system. The next component is the pump that's down in the scrotum. So it's sort of, the size of a 3rd testicle down in the scrotum.
I call it my pineapple.
And then there are cylinders that go inside of the erectile bodies of the penis. So the penis, if you looked at it in cross-section, there's really 3 tubes that go through the larger tube of the penis. There's the erectile bodies that are at the top of the penis and the urethra that's on the bottom. So 2 paired cylinders on the top and then a urethra on the bottom. So these cylinders take advantage of that anatomy, and what was once blood-filled tubes that are engorging is now full of silicone and saline. And so what happens, Tom, you mind holding that? You can imagine that if this is in a flaccid state.
Now this would be in your pelvic.
Yep, exactly. So this is inside of the pelvic bones, up next to the bladder. And when you want to get an erection, what you do is you squeeze a pump, and this is all self-contained.
Yes.
So I tell people all the time, if you're showering next to someone at the YMCA, no one knows you have it in.
Right.
A partner is definitely going to know that you have it in. So when you pump the pump, that's transferring fluid from this reservoir through the pump into the cylinders that are in the erectile bodies of the penis, which is awesome and why we're here on the earth.
You can see it coming out of the...
Yep. And I did not inflate that nearly all the way, but you can see that it has some axial rigidity, and that gives you the ability to have an erection.
Yeah.
And then when you're done, which one of the best parts about an implant is if you want to have an erection for 10 hours, you can. You then push a separate button that's on top of the pump, and the fluid goes the opposite direction. And so
this is drawing the fluid back from a vacuum.
That's exactly right. So a lot of guys benefit from squeezing the cylinders inside, and then that's transferring the fluid back, and you go back to being flaccid.
I can feel it getting bigger.
Yep. Mm-hmm. And
now, one thing I will know,
flaccid.
When you press the button, you can feel a flutter.
You can.
Yeah. It's like a... So I equate it to when you blow up a pool float, it has that flap in there, so when you blow in, it doesn't let the air out because I think that's like the button.
It locks out. Yep.
And then when you squeeze it, it lets the air out, and sometimes that flap flaps.
Yeah, and I'm glad that there's that kind of haptic feedback, because when guys are learning to cycle the device, I say, "Oh, I'll physically be teaching them how to do it. I say, "Oh, do you feel that vibration?"
Yep.
And that's a big aha clicking moment for guys, which is always nice.
And I like the new pump because my original pump, when I push it, I'd almost have to continuously hold it until it went about halfway. Then I can let go, and I could still feel it. The new pump, it feels like a click. And then I just immediately let go, and I can actually feel it.
Oh,
but
cool.
you know, about...
No, you're fine.
Well, I say about 2 weeks before it went out, when he would deflate it, I could hear it.
Yes.
You could hear the pump.
Yep, and so that was a sign probably that there had been some mechanical failure. So in your device, I can't remember which side it was, but when we take them out to replace them, I always start by taking the reservoir out first, and then I take the pump out of the scrotum, and then what you have left is the cylinders and this tubing here. So this tubing that goes from the reservoir to the pump and from the pump up to these cylinders is reinforced with what looks like a slinky of metal, but this is where mechanical failure happens. And you can imagine if they're due to wear and tear, there's even a single pinpoint hole somewhere in the system, it ceases to function because the saline is going to make its way out of that.
And that's why mine took so long to notice.
And yours was you had a hole in the tubing going from the pump up to one of the cylinders.
Okay. Now, what's the back part of this?
Yeah, so super great question. So if we look at one of these individually, you have...
Well, let's start one more question.
Yeah.
These tubes here, because I post a picture of me holding this.
Yeah.
And they go, "Oh my God, is it that long?" Right out of the box.
Oh, such a good question. Such a good question.
I'm like, no, they size it to you.
Yep.
But then there are some people that'll say, when they were sized, they just pulled on their, you know what, and then said, "That's as big as you're going to be." And I mentioned, well, what if you still have that sponge material and you could still get harder?
Yeah.
And so, so
such a good question. So there's a number of questions in there, and they were all excellent questions. So this looks long, right? This
it looks Tom long.
Absolutely. That's what I was going to say that. I was going to say that. When guys first see this, a lot of guys' eyes bulge out of their heads and they say, "Whoa, I've never been that long before." What you're not accounting for is that this is the external and internal anatomy of those erectile bodies. And so when we get down into this anatomy and we're measuring the size to put these cylinders in, we're measuring in two directions. We're measuring out to the tip and also back to the pubic bone. So from the bone to the tip is this whole part. Okay. And a lot of that anatomy is on the inside. And as guys age and gain weight in that area, even more of that anatomy is on the inside. Right. And we're going to talk about that, I think, a little bit later on about subjective length loss.
And then I asked you what these were.
Yeah, let me show you. So the two main companies that make implants are Boston Scientific and Coloplast in the U.S. This is a Boston Scientific device. For all intents and purposes, the cylinders are very, very similar. The Boston Scientific has some advantages as far as it being coated in an antibiotic solution, which is probably beyond the scope of this, but I end up doing a lot of Boston Scientific devices. Coloplast is also great. There are really, if you think about it, really three components to one of these cylinders. So the middle component where the tubing connects, so this is just kind of more firm silicone. Manifold. Yep. And then you have this component that is what actually is filling and engorging with saline. And this is really kind of like a balloon portion out to a tip. And then the back is removable. And what this is called a RTE, which is a rear tip extender, or RTE. And this is what allows us to get a custom fit for each internal anatomy. And so there's a lot of misconceptions about the sizing and all of these things. The reality is that we always put in the biggest size possible and fit it to within a 0.5 centimeter for that guy. So for example, this Boston Scientific implant starts at sizes of 15 centimeters and goes up by 3. So 15, 18, 21, 24.
Now what would 15 be in inch-wise? Because...
Oh man, that's beyond that.
I know that 21 is 9 1/4.
Yes, so
I did research that part.
Yeah, it's like that's like when they talk about the ruler, like the man side versus women's side. Yeah. I'd have to get out a ruler and look for you. But so if someone was to measure the internal and external anatomy, we add that together while we're operating, and say we got a measurement of 22 centimeters, or for let's say 23 centimeters. So the options would be most likely using a 21 centimeter device and then adding a rear tip that measures 2 centimeters to get to the maximum length. And you don't want to oversize them. A lot of guys say, well, this is what I have, and is there any way you can just put in the biggest one you can possibly find? Which is a totally valid question.
Right.
Absolutely.
And the answer is, unfortunately, no. There's a lot of complexities that happen. So what would happen first is it would be very, very painful, because you can imagine that it's now a cylinder that's inflating and deflating in a space that it's too small for it. Mm-hmm. The second is you're prone to having things folding over or bulging out of the side. Ooh. And then the worst and scariest fear would be that because it's longer and you're compressing against those elastic tissues, that it physically erodes out of the end. So as much as you want as big of a device as you possibly can, what you really want is as big of a device as you can fit
that
safely.
Can fit and function.
Correct.
I've heard of devices sliding from the shaft back into the scrotum.
Yes.
Okay, so I didn't even know that was a thing.
Yeah, so usually when that happens, so the way that we put them into those corpora, into those erectile bodies, is by making what we call a corporotomy. Otomy just means making a hole in the corpora. And so that is one area of weakness, and that's where the tubing kind of comes out of those erectile bodies. So what can happen is the device can herniate out of that if it's sized inappropriately or secondary to other sort of intra-op things or the tissue quality. And then, that's a thing I've seen, unfortunately, for patients that come and see me due to the kind of bad past experiences where it has herniated down into the scrotum.
Now I have a question.
Absolutely.
One of the things that Bunny was all stoked about was you and the rep from Boston Scientific came out, and you gave her a pat on the back and said you were able to go a size bigger.
Yeah.
And was that because I already had an implant and I had made...
No, that was all me.
Oh,
no.
See, you get it right here.
No. So yes, yours was awesome, and it's obviously really validating as a surgeon and as a man in Western society, it's it's a little fist pump moment.
She was excited.
We were able to put in a device that was 2 centimeters bigger,
right?
Which is almost an inch bigger.
Yeah.
And what
an inch? It's like a football field to a guy.
Absolutely, absolutely. And we're talking real inch again. This is not
right.
No, and which is awesome. And what that tells me is that you did a good job cycling your device.
Oh, good.
So people, and we could talk about this for hours on ways that guys can optimize their length before surgery, ways I can during surgery optimize someone's length, and ways afterwards that you can maximize that. But the key thing is after the fact is cycling the device and giving it time. Cycle it, cycle it, cycle it. I encourage guys to cycle it at least once a day. If they have time, to do it twice a day when they're healing. And that was less important for you. So maybe we haven't had this conversation because you had a device before.
I had the device. So what would be like when he's talking cycling, he's actually talking about pumping it up.
Yeah, exactly what we did here.
Pumping it up to where it's comfortable.
So
I would pump up just one pass comfortable. It'd be a little painful because you got some foreign object in your body pushing, but I didn't also want to be in excruciating pain.
Right. The goal would be pumping it up till so you can tolerate it. And then what I tell guys is you're going to maximally inflate yourself, give it about 5 minutes.
5 minutes.
And then pump it up again.
Oh,
see if you can get another pump in there.
Okay, so you add pumps.
Yep. Mm-hmm. So the idea is these, like any other kind of elastic tissue, these can truly expand in both length and in girth. Mm-hmm. So the more you cycle it, the more elastic, and there's got to be some physics term that I can't think of.
Right.
That really helps guys regain the length that they may have lost. Your analogy that I love that you said earlier today that I'm going to definitely steal from you is the balloon analogy.
Yes.
Which is and guys can be, pretty frustrated early on when they're first learning how to use the device because it's easy when you're 6 months into it and it's very hard when you're 2 weeks into it to identify it, to know, and you get frustrated, and that's very, very natural.
I got it. So what I said is it's like blowing up a brand new balloon.
Yeah.
And your cheeks puff out and you're straining and you finally get that first breath of air in there and it gets a little easier. But then you keep doing it, it gets getting more and more elastic. Yeah. So you know what? I think you should, in your office, have little balloons and the bigger balloons that are easier and show them this is what it's going to be like. Yeah. And later on, this is what it's going to be like. And they'll have a feeling. Yeah, also, I like it. The first time you pump this is really hard. Yeah. And it has all these nodules on it. That's why I say it looks like a pineapple. And so these are for grippy. But when you're in your scrotum, I have to, hold on, I have to put my hand on one side of the manifold so it doesn't slip because inevitably in your scrotum, it's slipperier than snot.
Sure. Yeah. A lot of times they'll use a washcloth.
Yes, I'll hold my scrotum with the washcloth and squeeze it using the washcloth.
And that's something that I really try to emphasize to patients is that this is really a two-hand job.
Yes.
It definitely takes two hands. And if that second hand is from a partner, awesome. And you can use that as part of foreplay, and that's great. But it's really a two-hand job. And even when I'm cycling the pump for patients in clinic and teaching them how to do it, it's really about isolating and pulling this down to a location within the scrotum where you can have easy access to it, and then it's a squeeze. The only other thing, and this is getting kind of in the weeds a little bit, is when guys are learning to do this, the button that you push, a lot of guys are really frustrated. I feel the button, but I cannot compress it. And what they're doing is they're pushing it like this. And what's happening is they're just pushing it away. The reality is that inflation is a squeeze and deflation is also a squeeze.
And this is going to sound really morbid.
I love it.
But I taught Bunny how to deflate it because if I happen to die during sex, I don't want to die with an erection and have him pick me up because I hear the coroner calls it a forklift.
Yes, I like that. So to make it even...
Because of the two tubes.
Yeah, even weirder and more morbid, I often tell patients that my joke is, and you can have it fully inflated as you go, they lower you into the ground. So there you go. Just the last salute.
Right?
Yeah.
Last salute.
Yeah.
So now, okay, so here's a... so that was more me, and this is what is pretty much exactly what's in me. I tell people this is my future third replacement. I keep it handy.
Yeah, I like that.
But there's a rigid implant.
Yep.
And then there's what are these called, malleables or inflatables? So
you have an inflatable prosthesis or an IPP, inflatable penile prosthesis.
Okay.
And then you have a malleable prosthesis. Those are the two really big forks in the road.
Now explain malleable. I never even heard. Is that the rigid one?
Yes.
I know somebody who got one installed, and basically he says you're hard all the time. You just point it up or point it down. That's
exactly right. And so I don't have one. I wish that I did so I could explain it. But if you can imagine...
Next video.
Yeah, there you go. If you can imagine that all of these other components are gone. So all you have are these cylinders here. And now imagine that I describe it sort of like a bendy straw. So a bendy straw is going to keep its shape. If you take a bendy straw at the elbow of the bendy straw and bend it, it's going to stay that direction. And guess what? You can bend it the opposite direction too. And so what the malleable devices have is that what we call the proximal or close to the body side is a rod that is rigid, that is stationary. And then the distal end outside of the body is sort of like a bendy straw. And it's much more complex than a bendy straw. And it keeps its shape, but the idea is that a patient would physically just bend their penis down
to make it look soft.
To make it appear flaccid, and then when the time came, bend it up.
Okay.
So that is a lot of guys. I love that guys. Patients apologize to me all the time. They'll say, "Oh, I'm so sorry. I read online. I know I shouldn't do that." This is a soapbox moment tangentially. If a doctor ever says, "Yeah, I really wish you wouldn't research," you might want to get a second opinion.
Yeah, because I want to know everything.
Absolutely. Yeah. This is your body. I love when I strongly encourage patients to talk to me, go research it more, come back, talk to me again, because I never ever want to talk someone into a surgery.
Right.
He was watching videos of the surgery before he went in.
Yeah.
I love that.
And I always tell people are like, they're on Trimix. Yeah. And then when they go, "Oh, I could never do an implant," I'm like, "You're sticking a needle in the side of your shaft. What do you mean?" I said, "Yeah, my pain tolerance, both surgeries. I don't know why. Maybe I just took more care of myself.
Sure.
Is I think I was only in pain maybe a couple days.
Mm-hmm. Sure. Mm-hmm.
And after that, I was fine. I didn't lift anything. I just maintained myself. Kept 3 or 4 bags of peas in the freezer because they kind of cup everything.
Sure.
And but what I see a lot of people doing is trying to rush it.
Yeah.
And the biggest question I see on the implant Facebook groups, because I'm on several of them, and I do offer my opinions, not advice, I'm not a medical doctor.
Right.
But they always say, "How soon can I use it?"
Absolutely.
And I know my body.
Yeah.
And I know that while it looks healed on the outside, it feels healed, it feels good on the outside. I can only imagine what torture went through on the inside. And with it being a moist environment, how much longer does that take to truly, truly heal?
I just like talking to you guys. It's great. So patients ask, when can I use it? Patients ask, how long is the recovery? No. I think there are really 3 things that I really, really, really want to emphasize to men before they consider doing an implant. And the recovery period is one of those 3 things. So what I tell guys is, guys say, "Hey, how long is the recovery period?" I say the same thing every time. Recovery means something very different to every guy.
Right.
These are the restrictions that you have, and then you can determine kind of what you're comfortable doing with those limitations. So because the reservoir goes up into kind of the abdominal space, what we don't want is you to do a lot of straining in your pelvis or in your abdomen and herniate that reservoir out. The device, when that does happen, still functions, but cosmetically it can look like you have a little hernia because this reservoir bag of saline now is not where it's supposed to be.
And when you're done with that, remind me, I have a question on the reservoir, so keep going.
So what I say is no lifting more than 30 pounds for a month.
Hey, you can use that.
And
I did to my advantage. Bunny lifted everything.
That's right.
I did.
That's right.
I did.
And then the other thing I say is I want you to start cycling the device when you're capable of doing that, usually at about 2 to 3 weeks, cycling the device. And cycling, again, is just inflating the device, leaving it up for 10 minutes and taking it down. Most guys are able to use the device for its intended purpose after about 6 weeks. So that's usually the goal that I shoot for. Some guys are heal up real quick, but I agree completely with you.
I gave myself 3 months.
Yeah.
Only because I didn't want to have to re-injure myself and create a new surgery.
Absolutely. No, and I think
that was just my paranoia.
I think that's totally valid.
Not that it hurt or anything. Like I said, I healed pretty quickly, but I sent Josh some pictures of a guy who just got beat up. And we think the surgeon that he had very little experience. I think he was probably in the low numbers.
Yeah.
And
we should talk about that a little bit too.
Yeah, but but yeah, so he had to have a whole new surgery done because she just butchered it.
Sure.
And I had him call Josh, but we don't know where he went with that one, but that's okay. Now I'm hearing stories on Facebook where there are doctors who this pops out. You can physically see. You can't see this. You can't see none of this on me. You can't feel. If I didn't tell you I had it, if you were to feel around, you could feel the tubes going in, and you could feel the pump and everything. But if you didn't know, you would have no clue if I was walking around.
Yeah.
But when I heard that some doctors visibly have it where just below the skin, I said I would never have that because it's too out there, and I don't want someone to look at me and go, I mean, they already look at my hearing aids and go, what the heck are those? Sure.
Yeah, it's a great question. The way that I was trained, I had, like I said, my training, I have an extra additional training and emphasis in implants. The way that I was trained would be to put the reservoir as deep in as you possibly can to limit it from herniating out and for the best cosmetic outcome. As a tangent, there's really 2 ways of putting an implant in. There's an infrapubic, which is what you had the first time.
Above the shaft.
So above the shaft, up with an incision against the body wall.
I already had some hernias, so he just used the same area, so I wouldn't... I don't know if his was really the correct... I wouldn't advise that because it took longer to heal that way.
Sure. And then the alternative, which is the way that I can do both. I end up doing about 99% the other way, which is penoscrotal, so in between the shaft and the scrotum. The nice thing about that is cosmetically, once you're healed up, you have an incision that heals up on the scrotum that heals up beautifully.
It looks like a vasectomy.
Right. Which I like offering. And it's just a matter of preference and how you were trained, and both are fine ways of doing it.
Now, when you did mine, you asked my permission. You said I can go through the scrotum where you want to go through. You said I prefer to go through the scrotum, but since you already have that incision, do you mind if I also use that and go through both? And I thought, well, whatever makes it the easiest, most uninvasive. But I was just curious on why. Because it was the way it was installed, and it was just easier.
So the way you can imagine if it goes in on the top,
because I could feel the tubes over my pelvic,
and that's why I like to switch it to the other way.
I was wondering,
and so you can imagine the cylinders are the same. So if you're putting it in through the top, so we'll call it like the top of the shaft looking down,
over everything.
You're making an incision on the top, and these tubes have to go somewhere. And so what they do is when it's installed, you have to pick a side that it drapes over to, and it drapes over the shaft and then down into the scrotum. So one of the downsides of that technique is that you can feel the tubing more readily.
I could actually see it.
And it tends to be more exposed further out on the shaft.
Yes.
So again, this is not a cosmetic surgery. This is a functional surgery. But within those bounds, I want to give people the best cosmetic outcome as they can.
That explains why, because before you kept telling him to pull it down, where the other doctor never told him to pull it down at all. And even so, he was like, it is a lot lower than it was before.
Yeah, yours was pretty high riding, if I remember.
Yeah.
It was on the side,
Yep.
so it was kind of weird to deflate it and pump it. And even if I pulled it, it was already tight.
Yeah.
But where you did it to where the pump almost lays flat on the bottom of the scrotum, so it makes it real easy to find everything.
Yeah.
That's just another reason why I like to do it the peniscrotal way. So again, when I do it the way that I do it, the cylinders are up here, the incisions are on the bottom, and now the tubing kind of naturally fits where the pump doesn't have to drape over.
Yeah.
So the pump the tubing and the pump itself tend to be deeper in the body and thus more exposed or less exposed, more covered up.
So if you are thinking about getting it or talking about getting it, ask your doctor how they do it and consider what you just heard.
Yeah.
And you heard from me that it was a little more painful. Even for years, I could feel it in through my skin, and it would get a little achy sometimes.
Sure.
And because the pants bunching up and pushing on it.
But sorry to interrupt.
No, you're fine.
I would say while we're in that same vein of asking your surgeon, the main vein, if you will,
the main vein.
When this is a existential Josh Calvert thought of the day. I have a big family on the West Coast, and I'll have cousins call me and they'll say, "Hey, have you heard of this surgeon?" You're in Dallas, Texas. No, I've never heard of the surgeon that's going to operate on your shoulder. It's a big world. What I say is the same thing that I tell my family is what I would tell my patients, you guys, and whoever's listening here, is ask your surgeon. First of all, ask around before you ever get to this point. Ask your surgeon how many of the treatment or surgery or procedure that they're planning on doing on you they do. Because
so
that
when people recommend a high volume surgery.
Correct. You want someone who lives, eats, breathes, thinks implants if you're considering having someone operate on your genitals.
Now, on Boston Scientific, they I didn't even know this. I didn't even look it up on you. Someone said that they show certified.
Yes.
Like a little book, not a bookmark, but what's it called? It shows that you're qualified.
Yeah. So I've been, honestly, a great honor. As someone who's relatively new in my career, I've been in private practice doing my own thing for just over 2 years now. Was just recently honored with what's called a Center of Excellence that's based on patient outcomes and quality of surgery and a volume thing.
Okay.
So which is awesome. It's been, and if you look me up on the website, I think there's a little star that says.
And I looked it up, and I thought, but then I saw a bunch of other doctors that didn't have that.
Yeah. So.
And they were on the Boston Scientific site.
Yeah.
But I'm like, okay, so are they the newbies that haven't gotten to your level?
I would say some of them are, but here's what I would tell you too.
Or they just didn't do enough volume.
Correct. And so here's the thing is most people when they come out of residency training have done implants and say, so I'm pretty sure that the current iteration of those guidelines is that you needed to have done 10 implants.
Okay.
During residency training. So if you walk into a surgeon's office who's brand new and you say, how many of these have they done? And they say, and they give you an icky feeling, you should probably go in a different direction. In order to be considered a high volume implanter, you need to do 15 of these a year.
Oh, okay. I was thinking 50 a day. I don't.
No.
You know what I mean? Like it's a revolving door of implants.
So 15 a year. I this year will hit 100. So I'm considered a very high volume implanter.
Someone asked me on Facebook because I always talk about you, and they're like, "Is he a high volume implanter?" And I'm like, you know what? I don't know.
Yeah.
I'll ask them on camera.
There you go. Put me on the spot. No, I am. This is again. I did additional training in order to be able to do this surgery successfully. I've been very fortunate that I've had great outcomes, and I have a lot of happy patients that have had this done. And it's an area within my practice that I love. I'm very passionate about what I do. And I hope that number, if we come back and do this in 3 years, I say I'm doing 300 a year because I absolutely love doing this.
I'm going to go one step farther with you because most of the time, when you go to your family doctor and you want to see a urologist, because urology is pretty much the only ones that do implant, or Okay, so you need to get most of the time you need to get a referral.
Yep.
Well, what does the doctor do? They just go to the first name on the list
Yep.
and refer. And in this instance, I got you, thankfully.
Yeah.
But when I went to Indiana, the guy I went to, the first thing I asked, he goes, "Why are you here?" I said, "Well, because I have an implant and I want to build a relationship so I don't have to get a referral if something
Right.
happens." And he goes, "No one in Indiana knows how to do an implant because they don't honor them." And
Sure.
I'm like, "Oh, we're in the wrong state." And
Interesting.
we rented an apartment to buy a house there, and now we're in Tennessee. But I would recommend going on Facebook and talking to friends, family, but get personal referrals before you even ask for a referral from your doctor, so you can at least throw out some names to see if they're under your insurance.
Sure. Sure.
And that's where I would start,
Yeah, it's
knowing what I know today.
absolutely. I love that, and I would. This is definitely something that
Go
is.
ahead and keep talking. I'm going to turn on some lights.
I love it.
No, I agree.
This is. I'm sorry. Go ahead.
Oh, I was just saying, one of the things that you mentioned earlier is your partner will know.
Yeah.
But it in our lifestyle, a lot of women will say that they didn't know that so and so had an implant, because it really depends on the way that it has been implanted
This
and
is
if it's
going to
been
sound
correctly.
bad.
Yeah.
I'm going to go with her real quick and I'll let her finish. You know how many women have held mine and didn't even have a clue
Have a
until
clue.
we told them?
Yeah.
Yeah, that's awesome.
But I do notice that there is a big difference from the weight loss. Before, with the weight, when he was a lot heavier, I couldn't feel any of the wires.
Yeah.
And there was just a bunch of different things. Now with the weight loss, yeah, I can feel a little bit more, especially in the scrotum.
Yeah.
So yeah, you do retain weight down in there
You
too.
absolutely do, and a lot of people don't realize that, but a lot men who are bigger around the middle tend to have more scrotal fat, and so you can imagine if there's more cushion down there, you're less likely to feel something.
That's why we see those guys with the big nut sacks that have the big bellies.
Yeah.
Yeah.
Okay, see, I didn't even correlate the two. I just thought, man, they're just
packing it, man. Yeah.
not length and girth, but just
Just sacks.
Yeah.
sack.
Some people are into the sack, you know.
So we're very honest in our videos, and I should put the Tom strips up there real quick, just so people could see it. I've had ED since my early 20s, mid 20s, and she says we've had ED. Bunny stuck with me
that's really
through
sweet.
thick and
Yeah.
I
thin,
love that.
and I tried everything. Now I shouldn't brag about it, but I used to do Viagra and Cialis at the same 100 milligram Viagra and the full Cialis, and I called it a cocktail, just because it wasn't working.
Sure.
And the more I did, the less it was working, and I didn't realize the more you take these pills, you become immune to them.
There is some degree of that. I'm not trying to challenge you.
No. You tell us facts.
So they actually have studied that,
Mm-hmm.
and they have studied: do people build up a physiologic tolerance to these medications?
Or my ED was getting worse.
And that's what it is. And so
Okay.
what I tell guys is, if there is actually not a physiologic tolerance that's built up, if I had a twin brother and I took tadalafil every day for 6 months and he didn't at all, at 7 months our erectile potentials are identical physiologically.
Okay.
But there is a psychological tolerance that builds up, meaning, oh shoot, did I forget to take it today? Because you cannot escape, and I talk about this with patients all the time, you cannot escape the importance of the mental aspect, the mental component of getting a good dependable erection. It's vital.
Right.
It's vitally important.
Now, we did talk earlier. I call it wallering out the shaft to make room for the tubes.
Yeah.
Tubes, right?
Cylinders.
Cylinders.
Yeah.
So I want to get the
You're
terminology
perfect,
right.
man.
And I have friends that they don't feel any, like if they don't pump it up at all, they cannot achieve anything. And I always say, you know, me and Bunny, I'll pump it up as much as I can. And it's like you said about cycling it, add a couple more pumps. And then when we're in foreplay mode, she'll stop, she'll tap me, and that means pump it up more. And that happens 2, 3, 4 more times, awesome. And it gets thicker and longer each time. So I just equate it to, I was saying I still have that spongy material. And like you said, you talked about it being pushed to the side versus...
Yeah, so a lot of guys think that you're roto-rootering out those cylinders. And what happens for most men is that as part of dilating that space in order to create a space for the cylinders to go in, you're really just sort of displacing that erectile tissue. Right. And so that erectile tissue can still respond to your physiologic and kind of arousal state and engorge with blood. Additionally, if guys have still been able to maintain good blood flow to their members, the urethra actually has, so the urethra and the head or glands actually has a different blood supply than the erectile bodies. And so men who are healthy enough to still maintain good blood flow to that area, after the implant is put in, they can still have an engorgement of the spongy tissue surrounding the urethra and an engorgement of the head or glands.
And that gives me a follow-up question.
Yeah.
So we just talked to a couple, and he takes, he doesn't really have ED, but he takes daily Cialis. And he says he has no problem. Someone with me, I could still feel it getting thicker and longer without adding pumps, and then I add pumps to fill in the void is what I call.
That's awesome.
Would daily Cialis on someone like me who still gets some of that blood flow be beneficial?
Awesome question. And so, so the tadalafil, which is the generic form of Cialis, it's a 5 milligram tablet you take every day. It has pretty minimal downsides. If I was in an elected position, I would opt to just like dump that in the water supply because it's the greatest medication in the entire world.
See what I mean?
No, it's the best. It's the best medication in the world. But yeah, a lot of guys who have an implant that have noticed that they're, we were talking about it earlier, notice that what it feels like is a flaccid penis with cylinders inside of it.
Right.
One way to combat that is by taking something like a tadalafil daily. And that, again, allows engorgement of the erectile tissue that's still there and of those kind of accessory engorging structures within the penis.
And that goes with what Bunny was saying, and I'll let her give her description on it. When you have an implant, the tip doesn't get as firm unless you have that blood flow.
Yeah.
So mine was very spongy, and Bunny referred to it as...
pushing a marshmallow through a pinhole.
There you go. So,
and that's exactly what it's like. But I'll tell you what, when he got the implant, because we went forever with ED, so when he got the initial one, it was almost like having to learn each other all over again, because this guy came up to play. Sure. And he hadn't been there for years. So our bodies had to learn each other again, and it was quite interesting.
That's awesome.
Make a note to make an appointment to get the daily Cialis. A prescription.
We were along that same line. So because the cylinders can engorge and fill and become so rigid, you're really able to notice a comparison in real time between how firm the cylinders are and the natural softness of the head or the glands. So even if you took a physiologic erect 25-year-old, there is still a difference between the firmness of those natural erectile bodies and the glands. There's more engorgement in that healthy 25-year-old than there is in a 60-year-old who's had other medical comorbidities. But it really draws a sharp contrast between the rigidness of the cylinders and the softness of that glands. And that's a big complaint that a lot of guys have after the implant. And again, this is about expectation setting, is that they feel like, well, why isn't the whole entire member full. And the reality is because the erectile bodies end about halfway into the glands. And that's just the way that we're made. When we're formed, the head kind of wraps around. And again, embryologically, that's from the same tissue that the urethra is from.
Okay.
And so...
Because that's where it's getting its blood from.
Correct.
Okay.
And so that's why it, for some guys, it appears to be softer.
Eventually, it'll be PhD, Tom.
There you go. Yeah.
So, two couple things here.
Yeah.
One is, yes, 1,000%. If I just not aroused and I just pump it up, it looks skinnier.
Yep.
And the head is very
Absolutely.
floppy.
Absolutely.
But when I'm aroused and I want it, then...
Absolutely. No, that is exactly, you just summed that up perfectly. And that's something that's very important to know.
So arousal is important.
Absolutely. And honestly, it's the same thing as taking oral medications.
Yep.
The biggest reason why oral medications don't work or are not satisfying to patients is the movies make it look like you pop a pill and 15 minutes later you're hard whether you want to be or not. The reality is it takes stimulation. It takes erotic content, mental, whatever.
Everything.
So that it's the exact same thing. And so when guys get their implant and when we inflate it in clinic and they're disappointed, I'll often say, first of all, we got to give this some more time.
You want to watch a porn for 5 minutes?
I do not say that. But no, but I say, you got to go and actually use this thing with with whomever, as long as it's consensual. Yeah. And then you can really experience the benefit of having the implant be in.
Now, I do have a couple questions real quick.
Of course.
Did you have a question, buddy?
Mm-mm.
Okay, so one of my questions is people typically look at this as a 60, 70, 80-year-old.
Oh, yeah.
What's the youngest person? I don't know if there's a statistics other than like being in an auto accident or damage to it.
Yeah.
Like, what's the youngest male that's received one of these just because of normal ED?
Yeah, I can't speak to like the world record.
No,
youngest.
I know that. Just what you
the youngest,
heard.
the youngest that I have ever done.
Oh, okay.
Was a 28-year-old.
I was gonna say 25.
Yeah, 28-year-old who had a really, really sad story with a spinal cord injury.
Okay.
And he lost the ability to get erections. He was married, and that was something that was very, very important to him and his wife. And I was able to help him out, and it was amazing. And so nothing had worked.
You achieved an erection.
And I met my goal of, if you come to me, we can get you an erection. That's right. No, so that's the youngest. The oldest I've ever done was a 93-year-old.
Wow.
So, yeah.
So now, and I'm gonna just say this. Me and Bunny always tell everyone we talk to, if you're experiencing ED, start talking to a urologist today. Yeah. I don't care if you're 19, 28, 93, or 56, but I think I would have been a candidate at 25.
You would have definitely been.
And I wasted from 25 till 52.
Sure.
So I screwed myself out of 20-some years.
Well,
sorry.
No, you're fine.
I think a lot of that is males are hard-headed and they don't want to talk to anybody about it, and they're embarrassed. But you can't be. Now that we know what we know, you have to, because it could be just as easy as also too as a medication that's not.
Well, that's the thing that's fascinating is this has been around for 40 years. And the biggest barrier as to why we're not doing it, like you said, rotating door day in, day out, is because people haven't heard about it.
I know.
And other physicians and healthcare providers haven't heard about it. So the number of times that I talk to guys who are very frustrated and have been taking oral medications for 25 years, and they come and see me, and I explain that this is an option, they're like, well, did no one tell me about this? And it's a tragedy because... And it is exactly what you said. It is, we live in a culture where, one, we don't talk about our health. And as men, we certainly don't talk about our health. And as men who even talk about our health, we definitely don't talk about our genital health.
Right.
And so that's like my biggest... Yeah. Well, me too. Right? That's my biggest soapbox in the entire world. Like, I love talking to men about this. And the number one thing that I hear when I see patients back at their 6-month visit after the implant went in is they say... I should have done this 10 years ago. I cannot believe that I waited around and wasted time with injections and with I would have done this 10 years ago.
Yeah.
And I'll add something here. And this has nothing to do with if you're in the pineapple world or not. While mine and Bunny's videos revolve mostly around the pineapple world, we have a lot of viewers that are not in it, but they like our content.
Yeah.
But one of the things is I could see wives thinking that they are no longer attractive for their husband, so that's why the husband can't get it up, and the husband's too afraid to tell the wife because they don't have an open communication.
I cannot. I mean, you just summarized it beautifully, and it's about communicating, and that's what I am so fortunate when I have patients come in and they bring a significant other. Yeah. Whoever that might be, because that is an immediate biggest green flag in the entire world of, okay, these people are comfortable talking about it. It's almost a guarantee that when I walk into a room and there's a couple there, that they're going to be they're going to be open and honest, and it just makes it so much easier.
Well, you did make that you did say that to us in the beginning, that a lot of times that you are the first person that they ever talk to about it.
Absolutely.
And to these guys, I don't know why they're thinking that their wife doesn't already know.
Yeah.
Your wife lives with you. She's going to know you're having these issues. But and it's true. I mean, we talk to anybody about it. All of our kids know. We tell them exactly why. And that's one of the things is in the groups I see people all the time. Well, what are you going to tell your family? Oh, I'll just tell them you're having a hernia surgery. And I'm like, why aren't you telling at least your sons?
Sure.
Yes.
Because chances are, if you have it, if it might be something hereditary, your kids might have it. Or why let them struggle?
Yeah. So I have my test pump here.
Yeah.
So when we first were getting the implant,
yeah.
So here, I'm going to hold it up. Doesn't that look like a little pineapple? This is what goes in your nutsack. So, and it's a practice pump, and it has the button to put press. It doesn't actually function. It's sealed off. And I told everybody, and I here, take this, and I handed it to my dad, and I said, what is that? And my dad goes, it looks like a little pineapple. And I go, okay, yeah. He goes, what is it? And I said, that's what's in my nutsack. And he just kind of like does this. He goes, well, you can have it back. He didn't want to talk about it. Yeah. Nothing about it. But I showed it to my kids, and it's the dinner talk of the conversation.
Well, and that's just the thing, like we were talking about earlier, his father being 87, his mother, would have been 82. And it's just that fact that era, you don't talk about it.
Right.
Any of that stuff.
Well, the device on the whole, per the literature, has a 98% patient satisfaction rate.
Our travel company
and a 98% satisfaction rate and a 96% partner satisfaction rate. Absolutely. Which speaks to exactly what you're talking about. It's so sad when I see couples come in and to kind of take the time to uncover that and have women say, I'm nervous, he's not attracted, has something changed, is there something I'm doing wrong? And again, if you're in a culture or in a relationship where you don't talk about that stuff, this is why couples in their 50s say like, yeah, that used to be important to us and now it's not anymore. Because it's so sad.
It's sad. It's because they don't want to acknowledge there's a problem. And
absolutely.
It's hurting the guy. Yeah.
Well, can I tell a story? Yeah. That's my favorite story in the entire world. So I have I do see other patients. I'm sorry if that hurts your feelings.
I thought I was the only one.
I have a patient who is just an awesome dude and brings his wife in every time. They're like what you'd imagine a sweet Southern couple in their late 60s. He has a big deal job where he's in the C-suite of his company, and he said, Dr. Calvert, can I tell you this story? I said, absolutely, tell this story.
You love hearing stories.
I do. So this is 6 months after his implant is in. Okay, so 6 months after his implant is in, his wife's there, and she's already rolling her eyes. And he says, Dr. Calvert, I have to tell you the story. He went to this event in California where he was a keynote speaker at one of these sessions.
Did he pump it up with his suit?
This is not a TomandBunny story.
Okay.
This is a different story about this is a story about what it means to be a man, and that's why I love this story. He said, Dr. Calvert, this story does not end badly. And I'm like, okay, what is it?
No.
What is it? Okay. And she's rolling her eyes. He said he spoke at this thing. He walked into this networking event that they had afterwards, that it was at a restaurant and a bar that was next door to this conference center where he just spoke. So again, this is a guy who's well known in the company. From the outside world, that's a guy who's going to have confidence, right? That guy's awesome. He said he walked into this networking event and there was a 25-year-old woman that was at the bar. And he said, he described her. He said she was a good-looking woman. And she smiled at him and he smiled at her. And he said, remember, the story does not end bad. And again, she's like hitting him. He says, Dr. Calvert, that moment that I realized that if one thing led to another,
oh my God, yes,
that I could go to a hotel room and be able to perform. Mm-hmm. He said, the confidence that that gave me as a man, and the confidence that that gave me for the rest of that weekend networking and going, he said, if I never use the device ever, it was worth it for that moment. And I was like, that...
Absolutely.
That story, I love that story because that sums it up.
That's actually very accurate because, see, a lot of guys want to equate their ED to stage fright.
Yeah.
And like seeing a girl and going to a room and all of a sudden can't get it up because they are scared. I think they should be looking into more deeper.
Yeah.
They go, well, I don't have a problem with my wife. I didn't really have problems with Bunny, but me and Bunny, it was, well, I mean, I did, but I could still get it up for a couple seconds.
Sure. Well, actually, that brings me up to another thing. So I try to simplify things. I'm a pretty simple guy. When it comes to erections, I really, and I don't think I ever told you this again, because we kind of met each other halfway through your story.
Right.
I'm glad we met, but when I'm first meeting guys, what I will describe to them is that erections are a binary variable. It's not, this is not a spectrum. It's either a 0 or it's a 1. And I'm not saying that my patient is a 0, but when it comes to their erection, it's either a 0 or it's a 1.
Yep.
So what is a 1? A 1 is you have a firm erection when you want, that lasts as long as you want it to, that's not painful or embarrassing for you or your partner, that's a source of confidence and satisfaction. That's a 1. Anything that's not a 1 is a 0. I love the analogy of a ski lift, okay? If you're going to get on a ski lift, the fun part is the skiing down, right?
Yeah.
Skiing down the mountain. You're not going to get on a chairlift if you're not 100% confident that that's taking you to the top of the mountain.
Right.
If you have a 90% chance that it's going to take you and a 10% chance it's going to drop you off a cliff halfway up, you're not getting on that chairlift. So that gets in your head. So the idea is you want to get to the point where you have a 1. So the number of guys that I'll see who I'll put on an oral medication and I see them 3 months later and I say, well, how's it going? And all I want is to hopefully have impressed upon them that they can be honest with me. All I want is for them to say, I'm a 1. And a lot of them say, yeah, it's okay.
It's
and I'm
okay.
like, no. And that's where so many guys, I think, not waste time, that's the wrong word, but delay something that could improve upon their quality of life so much by being more aggressive. There's really 3 and only 3 evidence-based ways for men to get erections, and then there's a whole bunch of other stuff you'll hear on sports radio and see online. Mm-hmm. But oral medications, Viagra, Cialis of the world, injections like Trimix that you've talked about before.
Trimix?
I do.
Okay.
And then an implant. That's it. Those are the only 3 options.
Right. And I went through all of them.
Right. Mm-hmm. And you don't have to necessarily progress through all of them. Most men do.
My first doctor said, because I wanted Trimix, because a friend gave me a shot. I tried it. It worked. Yeah. And so I went in and as he said, I self-prescribed, and it didn't hurt anything. So why not? Why not go the least evasive route? Sure. He goes, but you should have had an implant 2 years earlier. And I'm like, oh, I wish you would have verbalized, saying, hey, you could do this. However, you may want to start thinking about this.
One of the things that guys, that's again, kind of one of the big things I try to emphasize when guys are considering an implant is that this is the final stop. This is
yes, we are going to talk about this.
Yeah, so this is the end of the road. Once the implant goes in, if it came out because of patient dissatisfaction or complication or an infection, which happens about 1% of the time, even in the best hands, there is no other way of getting an erection other than putting a new implant back in.
Okay.
So you can't backtrack from going from an implant to trimix.
So when you push the cylinders up and it pushes, what's it?
Corpora,
whatever it's called.
Yeah, the corpora. Yeah.
Okay. So when you pull it out, those don't magically.
They don't heal themselves. Correct. And so another thing that happens that's really sad is a lot of times that will scar down, and guys will lose a lot of length after the implant has to come out.
When these are in, does the inside actually adhere to this, or do these still slide inside? That
great
was
question.
A question I always had.
So once you're healed, so say you're 2 years out of surgery and everything's fully healed, it is scarred into place and then really invested in that tissue.
Okay.
So it's not sliding.
Okay.
When you're early on,
I could almost feel it sliding a little bit.
Yeah.
And it was a concern at first, not yours. It was just, I'm like, wow, I can actually feel them moving. And then over time, I didn't feel them move anymore. Yeah. So I was just curious on that.
It sort of scars in and just becomes in continuity with the tissue.
Now, another thing I see a lot posted on social media is people who are having radical prostatectomies. Mm-hmm. Now, like Bunny said, I was part of a prostate forum group for years. I videotaped them, and I watched all these amazing doctors who weren't just following the government, but they were developing, I don't want to say cures, but ways. I mean, our boss had stage 4 prostate cancer for 16 years. And like you said, it was the slowest growing cancer. I'm not giving anyone advice, but always research. Do as much research before you pull that plug. But do a lot of the people who have had radical prostatectomies weren't really told that they were going to lose their erections, or even told about implants. They were just told, we're going to save your life. We got to pull this little walnut out of you.
Right. So the most common guy that gets an implant still to this day are men who are post-prostatectomy.
Okay.
And so men have a prostatectomy for prostate cancer. It's the most common cancer type in men. One of the treatment options, if it gets to the point where it needs to be treated, nowadays we watch most prostate cancers and just keep a close eye on it, called active surveillance. But if it gets to the point where you have to have your prostate removed, one of the very common known complications is it impacting your ability to get an erection. Whether it makes you completely impotent or worsens it, it's sort of hard to say, and it depends on a number of factors. But the reason why is because the nerves that are required for you to get a good dependable erection run right along the kind of what we call the posterolateral, or the outside surface, the capsule of the prostate. And so unless those are meticulously dissected off, oftentimes those nerves are injured, and that impacts guys' ability to get erections. Fortunately, there's been a huge push, and it's something that I do in my own practice. You've heard of rehab. I do what's called prehab as a men's sexual health specialist. And so I have a number of partners within my group that focus more on urologic oncology, removing of prostates and kidneys and bladders for cancer. Mm-hmm. I see those patients before surgery, and we talk about all of this stuff beforehand, which has been hugely beneficial for my patients. And a lot of urologists will say, like, well, I don't want, my patient's not going to be willing to undergo a surgery if they know about erectile dysfunction. I feel the exact opposite. I want a patient to make an informed decision, and I want to give them hope that if they are unfortunate to have that complication, that we're going to get that part of their life back. And and for me, that's I can't say it's as important as getting rid of the cancer, but I'm glad that I do this end of it, not that end of it.
Well, I can see you advising your patients, hey, we got to go this route, but no fear, once we get this healed up, we're going to go this route, and we're going to get you back to real life.
Absolutely. I would say because
but there's a lot of doctors that don't.
All of the men that we know that have had the implants too have
had a prostatectomy. Yeah.
So here's a burning question.
Yeah.
I've seen debates going on. Can a male have an ejaculation just based on prostate stimulation alone, with no other stimulation? I'm just
absolutely.
Here. Oh, so they can.
Absolutely.
Like orgasm out.
Absolutely.
Okay. All right.
Yeah.
I just saw.
You want to get really in the weeds about this?
Yeah.
Like
these people would love it.
Like so far in the weeds, it's not even funny. So again, this gives you some insight into how my mind works. I love this stuff. I really do. I'm very passionate about
Yeah.
this stuff. When I was in residency, I tried and tried and tried. This is going to be a silly story. To get IRB approval to contact men who had had radical penectomies for penile cancer.
What's penectomy?
A penectomy is removing the entire penis.
Oh,
Ooh, I didn't even know
I
that was a
had
thing.
no clue that was.
So this is like I said, we're getting real in the weeds here, but penile cancer is fortunately incredibly rare. But the most sort of extreme treatment option for men who have advanced penile cancer is removal of the entire penis. And then rerouting the urethra. And again, we're getting way in the weeds.
Right.
But these men still have prostates. And there is some literature. So I was fascinated by this. I was at Vanderbilt. We did a lot of oncology. And I was kind of more interested in some other things. So that's neither here nor there. But there is some literature out of India that suggests that there are men post-penectomy, removal of their penis, who are still able to ejaculate secondary only to prostatic stimulation.
Okay, because there's...
So you don't even need a penis in order... Yeah.
Right. Well, there's a lot of people that are into pegging, the wife with the strap on.
Sure.
And of course, so this leads to a couple things, whatever people do, there's always someone that's going to talk down about it.
Sure.
And like me, when I post videos, I got responses of, how could you even do that? That would be embarrassing. Must suck to be you. And my reply would be, you know what? I am so happy you don't have my problem.
Sure.
Because if you don't have to have pills, injections, or an implant, then you're way ahead of the game.
Yeah.
But I would never put someone down for any health reason. We're a positive couple.
Yeah.
But I didn't understand what the whole pegging thing truly, if it did stimulate that much or not. You've seen what was a road trip where they go in to donate semen and the nurse gives him a prostate massage, and so that's the next thing he's into the rest of his time.
There you go.
And so I always question, is that a thing?
It absolutely is.
Okay.
Yeah.
So
yeah, great question.
Something you could try with your wife's husband or
whoever.
Whoever.
As long as it's consensual.
Yes.
And it's not hurting anyone. That's where I feel about that. Like, I don't know. Hating on someone for someone else's health condition is pretty. That says a lot about you.
We have to have thick skin to do these videos.
Yeah, I'm sure.
Oh yeah.
I'm sure.
One of his, and it's not with his penile implant, but it is with his hearing aids. He'll say, can you speak up? I'm hard of hearing, and they go, huh?
Oh, they do it as a joke. It's just like, you don't think I've heard that all my life.
And he'll let it go.
Sure.
And then he'll finally look at somebody and say, hey.
Would you kick a person in a wheelchair that fell over instead of helping them pick them up?
That's so sad.
But it's the truth. It's the same analogy.
Yeah. Yeah.
When I say, can you speak up, it's because I truly want to hear you.
Right.
If you're talking to me and I start looking away and stuff, that means you're obviously not speaking up, and I probably don't care.
But hey, I actually want to touch back on the men not talking to their wives. Because when people find out that they do have it and everything, the guy's all, oh yeah, I'm fine and everything. I don't have any issues. And then the lady will come up to me and go, he's lying to you.
Yes.
Yeah.
He's lying.
Yeah.
But yeah, I one thing, if you take away anything from this video, if you're a married couple, talk to each other, always be open. Me and Bunny have no shame. We talk about everything under the sun. Like I say, if we ever divorce, she has so much ammo on me.
Because this is our TomandBunny channel, and I will tell you this funny story for us. When we knew, obviously we've known forever he's had issues, but when it came to the breaking point is we were right in the middle of going at it really, really well, doggy style, okay? I'm right in the middle of menopause, and all of a sudden he just was like, done.
I go out, and then before I go in, it was soft, that fast, and it just...
And I go, and he pulled away, and I'm like, is everything okay? And he goes, your ankles are sweating. It was the ankle sweating that was,
That was
like,
it. It's
it
too
was
much.
the stop here, and everything was like done.
I forgot about that one. When I was having ED, we'd go and all of a sudden I would pull out to go back in, and I'd just be soft before I could even go back in.
Yeah.
And it was just that fast.
Well, it's important. It's important for human functioning. It's important as an individual, and it's obviously important as a couple or whomever you're using it with. I mean, it's part of human beings bonding.
Yeah. I have a question from one of the people in the ED group.
Yeah.
I put a poll out. We haven't even talked about this. We have a list of questions from people on the internet too. So we're going to do multiple videos. So we might even go down to his office and just take our camera and microphones. What's a VED?
Yeah, VED is a vacuum erectile device.
Okay, I kind of figured that, but they didn't explain it. They just said, should a VED be used before and after, or just before?
Awesome question. So a VED is a vacuum erection device. It's a penis pump. You can buy them at any adult store. The caveat to that is, I wish that I had a sponsorship. It'd be cool if I had like a little thing right here. Make sure you get one that has a gauge in it and has a pressure release valve, so you cannot inflate it more than is physiologic.
Okay.
So it's very important.
What happens? Do you break
blood
cells?
You're just much more likely to damage your skin and damage your genitals.
Right.
And so a medical grade one, which we do sell at our office, which is awesome, but maybe we can come up with a link on the video or something.
We can.
So a VED is a vacuum erectile device, and the question is, using that before or after implant surgery. There is data to suggest that it improves pain post-surgery by using it in the study was 3 weeks leading up to implant surgery. And there is newer data coming out suggesting that using the VED after surgery maximizes your potential length. So as part of the healing process, really fully engorging those tissues with blood, that it can make it easier to inflate and really make sure that you're getting the maximum amount of length out of your device.
My first doctor mentioned nothing about that.
Yeah.
So,
it's sort of in the men's sexual health world, it's a pretty common recommendation. But again, a lot of doctors are not real comfortable talking about this kind of stuff, period.
Now, another question is, these things are like 40 years old. Can you just give a short description on how it evolved 40 years ago to today?
Yeah.
Has it stayed literally the same?
Oh, great question. So honestly, the device itself has remained relatively unchanged. So
That's what I heard.
It's always been 3 components. The biggest advances has been with the individual composition of these things as far as increasing the length of time that they last. And there's always little things coming down the pipeline. What's really exciting is hopefully within the next 5 to 10 years is there's going to be something called the eIPP, which is an electronic IPP, and this sounds like too good to be true, but it's going to be life-changing for a lot of men.
We talked about this one.
And that what it would be is you would eliminate this portion, the pump portion. You would have a reservoir that is attached to a battery pack that, again, is implanted inside of you, and then all you're going to have is a phone app, and you're going to say, all right, it's time, and you're going to scroll it up, and Bluetooth, some technology that's smarter than me, is going to register, and that fluid is going to transfer without having to pump it and give you an erection.
So let me ask you a question.
Yeah.
Before they all run to be part of a study, can you work magic and get me on the list to be one of the test dummies?
We'll see what I can do.
Hey,
we'll
you know what though?
Because that would be kind of cool.
No, it would be awesome.
But when that happens, I am going to franchise into one of like the Verizon stores and be open 24 hours.
Yeah.
I guarantee someone loses their phone, they're going to be running to get a new phone.
They should have a backup.
That's really
now,
funny.
like my implants, my hearing. We're going to do a video on my hearing aids because a lot of people they're either afraid to ask me.
Sure.
Because they don't want to offend me,
Sure.
or they do ask me and they're amazed on what I tell them. So we are going to do a full video.
Cool.
But my implant, is basically dead without the hearing aid. And with the hearing aid, the battery in this powers
That's cool.
the implant.
Yeah.
So I don't know if that's something that, because how would you, I mean, that would be a hell of a battery.
Yeah. Well,
There's got to be a way to charge it wirelessly.
There's other.
I'm sure they think of that.
There are other applications. If you think of like a pacemaker,
Yeah.
too, where they're implanting a battery, and those batteries can last 15 years.
Oh, okay.
But there are a lot of applications now where you have like near field technology, like how you have for your phone charging, that you can just put that over it and recharge it.
That's what I was thinking.
Yeah.
I was going to say, because what you're saying, pacemakers last 10, 15 years. Well, that would be for normal people. That's why they need
for normal
me to
heterosexual
be a
use.
test dummy,
That's
so
right.
we can show them your battery's dying.
That's smart. That's smart.
You'd be hooked up to a USB device.
Well, they already call me the Bionic Man
There you go.
because I've had hand surgeries, pelvic surgeries, ear surgeries, implants.
That's so good.
So, but yeah, we're definitely gonna. I think what time is it? Because I know. I mean, we could keep talking, but oh yeah, we're an hour and 20 minutes. We can talk for 10 more minutes, and we'll call it a day. And
That's great.
did you know Vanderbilt beat Alabama?
I am aware. I'm
Did
not
you
a
see all
Vandy
my
fan.
Alabama
I did.
stuff?
I did
You're
see
a
Right,
that.
right there.
I did see that.
You're a Husky,
I am
right?
a UW Husky fan. Yeah. Yeah.
But Vanderbilt deserved it. I mean, they got bragging rights. Whoever the quarterback was, but the whole team,
Yeah.
they'll be bragging to their great grandkids.
Did you see the video of them throwing the goalpost into the
Yes.
Cumberland?
Yeah.
That was
What
amazing.
cracked me up was when Tennessee beat Alabama. They did this. They took down their. And I'm like, you guys kind of go back and forth. Vanderbilt, hell
That's a big
yeah,
difference.
throw
Did
the
you-
whole
It's ridiculous.
goalpost
Did you
in
hear
the
that
river.
Garth Brooks bought part of it to put in the bar?
That's
And
pretty cool.
Broadway?
Yeah.
That's pretty cool, actually. No, I had
It
not
probably
heard that.
went to pay the fine.
Yeah.
But what's the
that's
fine?
awesome.
$200,000 for ripping down a goalpost?
But I started laughing. I was like, how did we get beat from a team that's known for medical school?
Yeah. Yeah, it was a once in a lifetime thing.
Yeah. So yeah,
But,
go ahead.
oh, I was to say, because that is one thing that is great about living here in Nashville is we do have that option
Yeah.
of Vanderbilt.
Yeah.
So a lot of people don't know of that and different things that they offer. And I've heard that a lot of the interns at Vanderbilt do work with the VA, correct?
Mm-hmm. Yep. Yep. Absolutely. Yeah. As a resident of Vanderbilt, when I was there, I spent a year and a half of my 5 years there working just at the VA.
Mm-hmm. Yeah.
So,
You're
So
a
good
resident
training.
for.
I was a resident for a long time.
Wow.
Yeah. I did 17 years of school, master's degree, med school, residency, fellowship, 17 years after high school before starting. So,
I
a long
can tell
road.
you're a very intelligent
is.
person. You speak
That is a
very
long run.
well.
well, I appreciate that. Yeah. And now I just talk about erections all day long. So
And the nice thing is when
took me 17 years.
17 years. When we were setting up my surgery, Josh sent me over links to all of his videos to explain, and I watched. Even though I had one, I watched every
Yeah.
single video just because I knew you were going to be a different person
Yeah.
than the other person.
Yeah.
And they were very well informed because my other doctor gave me 2 minutes of each
Sure.
visit.
But your
and-
other doctor was a lot older, so I think he was at that point where he was kind of just in and out, in and out, in and out.
Did I tell you when? Go ahead.
But no, I was gonna say if you like to talk about erections now, I can imagine what you were like as a 4-year-old boy. Your mother was probably
He was
like,
probably
is
showing
he
it
ever
to
going to
everyone.
grow out of this?
No.
No, I did not. Yeah, and now it's what I do. It's great.
So
That's really funny.
When I went in for my second follow-up, my first doctor asked me, he goes, so everything fine, everything normal? And I said, yeah, but I keep hearing things in my head. And he's like, you're hearing things in your head from an implant? I'm like, yeah. And he goes, what are you hearing? I'm like, pump up the jam, pump it up. His nurse just started
so
busting out laughing. He did not find that funny.
I am not going to call into question your original surgeon, but if you can't laugh throughout this process, yeah, I have maybe we can link it. I actually have I have an implant playlist that I play.
Do you?
I do.
Like when you're doing the surgery?
I do.
Oh, God, I got to get that playlist.
Yeah, I do. It's the best.
Pump Up the Jams in there?
It definitely is.
Oh, my God.
It definitely is. Yeah. Yep.
Well, one time we were with the kids, and they were playing beer pong or something like that, and my one son's like, "Here, Mom, you got the iPod for a while." And I started doing Pump Up the Jams, and then I went, push it. My daughter's like, "Will you get that phone out of her hands?"
Oh, that's great.
But like I said, I think that's the importance that our children know that if anything happens, that, hey, it's not the end of the world.
Sure.
Mom and Dad have gone through this.
Yeah, I love that.
And, you know, and they'll call and they'll ask questions that you don't think that people, you know, kids are going to ask their parents. And I just think that that's part of the communication is not only with your spouses, but with your family. Just, I mean, it sounds warped, but what other way are you going to know?
Right.
Yeah, I think that's been kind of a theme of this whole conversation today is, you know, y'all's communicating as a couple, communicating with a physician. I think what I've told people all along, what I lack in clinical knowledge, I make up for in enthusiasm. I love talking to patients about this stuff, and so I think I'm a big advocate for open communication about hard topics and or soft topics that can become hard.
Now, let me ask a question. If you got this is just hypothetical, but I'm sure it happens. If a patient comes into you and says, "Is there someone I could talk to about their experience with you?" Are you allowed to give them like our name and number and say, "You might want to talk to them"? Man.
Yeah. So it's something you and I have never talked about before.
Yeah.
So specifically through Boston Scientific, they have a list of maintained what they call patient advocates.
Okay.
So patients who have additional questions and they want to get kind of a real world boots on the ground.
Boston Scientific want like a Tom-and-Bunny on their list?
I mean, I think you guys are
pretty
great.
out there.
To ask. But I actually have that maintained as well. And I don't ever ask a patient, but I've had a number of patients who have asked me that.
I think I would see some of it, and I'd see people avoiding asking because of HIPAA and stuff like that. But if you have a signed agreement, I have a little, basically a consent form, and I have a list of patients who have very generously said, "I'm so happy to have anybody call me." Mm-hmm. So, all right. Yeah. Well, you could put us on your list, and we'll sign.
Cool.
We'll sign our life
away.
Love it. Because I mean, I am really, really, really happy with this.
Yeah, and I've had wives call me too to ask me questions.
That's
you will not be implanting this in your ear.
No, not at all.
That's right.
That was just a joke.
Yeah,
I like it.
So anyway, Josh has somewhere to go, but we are going to do more videos. If you watch this, we always do this. If you watch this video this far, because we're an hour and a half in, pump up the jams in the comments.
Yep.
Yeah, absolutely.
Or I want to hear Josh's playlist.
Yeah, there you go.
And but ask questions. Or if you're afraid to ask questions because it is a public media, YouTube, send us a DM. I mean, we're available on all social media, Instagram, Twitter, YouTube, and Facebook, TomandBunny. Just like you see it on your screen.
It's awesome.
So I told you I get to use those buttons occasionally.
I love it. It's pretty fancy.
All right. You got any last final words? I'm going to put your business card up here at the end. I'm also going to put his information in the description. And once he gets it over to me, I'll put the link for the VED.
Yeah, perfect.
So, because I don't think I would recommend them buying it from you. And we don't make a profit off of this. This is something that we advocate. But going to any adult store, you don't know the quality. Yeah, I definitely recommend a medical grade. A medical grade. So, and the people behind the counter at the bookstores aren't going to say, they're just going to go, I don't know. Right. That one's the most expensive one. Right. Yeah. No, this has been awesome. I'm so glad we got to do this. This has been super fun. Hopefully we can do it again soon. Oh no, we are going to do it again. All right, deal. Yeah, because I think people want to watch this because it's something they relate to personally. Sure. Absolutely. So. And we've gotten a heck of a lot more information than we ever had before. Right. Cool. And we have a list of questions to go through. Yeah, we haven't hit. I love it. Yeah. Perfect. All right. So until next time. We'll see you soon. We'll see you soon. Bye, y'all.